Nose Health Tips, 226 edition. Nasal irrigation, the #1 tool for nose health. 1. Daily saline rinsing physically removes allergens before they ever reach your bloodstream. Rinsing the nasal passages with a saline solution physically removes pollen, allergens, and irritants from the nose, reduces post-nasal drip and congestion, and prepares the nasal lining so medicated sprays absorb better. Nature 2. Once or twice daily with sterile water is the safest and most effective protocol. Used with sterile or distilled water once or twice daily, nasal irrigation has virtually no side effects and is widely recommended by allergy specialists. Nature 3. Nasal irrigation is the foundation of all nasal hygiene, according to ENT specialists. Nasal irrigation, also known as a saline rinse, is a cornerstone of nasal hygiene. Gently rinsing the nasal passages with a saline solution using a neti pot, squeeze bottle, or irrigation device keeps them clean and moist.
Nobody driving, we're in the back to the end of the world.
Durbriant escabeau. Always use sterile, distilled, or boiled and cooled water. Never tap water due to rare but serious infection risks. Hydration and moisture. Don't let your nose dry out. 4. Drinking enough water is a direct nasal health strategy, not just a general wellness tip. Staying hydrated is essential for nasal health. Drinking an adequate amount of water helps keep the nasal passages moist, preventing dryness and irritation. Durbriant escabeau 5. Dry air worsens. Sinus pain and pressure. Moisture is the fix. If the air is dry and you're having sinus problems like pain and pressure, keep your nasal passages moist using a humidifier or vaporizer. Warm showers, warm compresses, or steam. PubMed Central 6. Dry indoor air is the most common cause of nosebleeds. Nosebleeds are common, and dry air is the most prevalent cause. Other triggers include allergies, blood-thinning medications, or a deviated septum. Your environment matters more than you think. 7. Change your home's air filters every 1 to 3 months, especially if you have allergies. Changing your home's air filters regularly, ideally every 1 to 3 months, helps prevent sinus infections. And if you suffer from allergies or live in polluted areas, using HEPA filters is recommended. PubMed Central 8. Cigarette smoke directly damages your nasal tissue, even secondhand exposure. Avoiding cigarette smoke and secondhand smoke is important because it can damage nasal tissues and impair your nose's natural defenses. PubMed Central 9. Keep windows closed during peak pollen season and use air purifiers indoors. Keeping windows closed during peak pollen seasons, using allergen-proof bedding, and using air purifiers reduces allergen levels indoors significantly.